This will be the last question, but yeah. Can you send it out from there?
Yeah, I can. My name's Carter. I'm a I've been studying MBSR in our interns as a randomized control. And recently,
I'm sorry, say that again so I understand exactly what you're studying.
I've been studying your 8-week MBSR course through an instructor.
Oh, okay.
On our incoming surgical interns.
Fantastic.
For 2 years now. And it's been fascinating what they get out of it, what we see.
You're seeing something interesting coming out of it?
We really are. But what I wanted to
That's huge to hear. I mean, it's like.
What I wanted to say was, I'm eternally grateful to you for what you created. And as part of the thanks, I want to tell you that we recently began doing a similar study in faculty with surgeons. And the other night, one came to class and said, I've been up all night transplanting kidneys, and I have 3 more waiting all day tomorrow. So over 48 hours, he would have slept maybe 3.
Right.
And we said to him, why are you not on the floor in your office early? Why are you in class? And he said, because I realized he's in week 4. This rejuvenates me more than sleep every night.
Well, you've just made not my day, but my universe. You know, I mean, you know how long I've waited to hear that from the Department of Surgery?
What I'd like to ask you is, just your comment right there about surgery, that's the hill I have to climb. And I know in the 70s and 80s, surely you must have climbed an equally steep hill.
Yeah.
So how do you keep the long
Mm.
and keep your...
Yeah. Well, one way would be any way you can. Trust yourself. Okay, so it's like you can't be anybody else, but you can be 100% you. And your whole life and all of your training and everything that you succeeded in up to this point, that brought you to this point, that's all culminating in this moment. And there's a lot of trustworthiness in that and in what you know really is begging for some kind of emergence, even if you can't fully articulate it or argue why, the curriculum should have time for that kind of thing. But if you know it and you care that much, that's how things change. That's how institutions change. That's how minds change. But you do have to be in it for the long haul. On September 11th, I was actually teaching with my wife out on Whidbey Island in the Puget Sound on September 11th, 2001. Okay, so couldn't get home. No planes flying and there were gigantic warships all over the place, because it's Puget Sound. And we went to visit a Japanese Zen master who has a place on the island, a Zendo on the island. And at the end of us being there for the day, because I just didn't want to watch the towers come down one more time, we went to visit him, sat with him that day. He gave me an enzo, a Japanese calligraphy of a swirling one stroke circle, and underneath it said, "Never forget the 1,000-year view." And I have a 1,000-year view. You think that, the idea of bringing Buddhist meditative practice without the Buddhism, but without losing the essence into the mainstream of Western civilization, never mind medicine, that's it's absurd. And yet, if that's what you love and if that's what you see your potential contribution to be, then you do it, but not for your ego or for, your own self-aggrandizement, but out of love. You've gotten this far. I mean, it's totally amazing. I think that the world is literally starving and dying, including surgery and the culture of surgery and the culture of medicine, dying for this. And although there's all sorts of beauty also unfolding within it. I mean, it's both. It's not either or. That's why it needs a dualistic wisdom approach. And that's something where you see no one can tell you how to do that except your love And if you trust that and you practice, nothing, it will emerge in some form or other because you care. That's the way I see it. And I don't see it that way just because I happen to, quote unquote, succeed in what I wanted to do. That was the principle from the very beginning. And that's what I think all of us need to be doing. Because sooner or later, we'll all be dead. No kidding. I don't think there'll be any exceptions. And the question is, like, between now and then, how do you want to live? How do you want to live, not die? And that includes, how do you want to work? My friend Ron Epstein, just to mention it, because I played on the word attending, he wrote a book called Attending, all about mindfulness in medicine. It's really good. It's really worth reading if you're a physician, especially. Because a lot of the time we get straitjacketed into forms that we're dying in medicine, and sometimes even our patients or the institution of medicine is dying for. And I think the time has come for medicine to, in some sense, reclaim itself and surgery, and not have it be a commodified thing that business people decide how this is all going to unfold. Its roots are in the Hippocratic Oath, and that is, one, first do no harm. And how could you even know if you're doing no harm unless you are aware? And the other, and really aware, and the other thing is that you basically putting the other's needs before your own. The patient's needs come first. And that's selflessness. When you're enacting selflessness, you're embodying that Hippocratic ideal, but it's not an ideal when you are willing to stay real. Now, how you do that without enormous, enduring, permanent cost to yourself, that's the art form of the practice. And it does include sometimes saying, I'm off. No, I can't. Because you have to take care of the instrument or the work won't get done. But I would say that, we could talk forever about that one. So it was the last question and it's winding up. I'm sorry. But I'm so glad you got to ask it because deep bow to you for what you're doing. Music to my ears. Well, we're all in it together. That's the beauty of it. It's like there's no central node here. And when we all take responsibility for this, and this is how the country is going to change, by the way, and this is how social justice is going to emerge. And it's like it's not like, oh, let's let a few big shots, whether they're white men or black women or trans people, let's let a few big shots take care of it. Bad idea. Let's have it be emergent and we're all taking responsibility for it as cells of the one body politic, as citizens, as people who care about medicine. At what point do you care enough about medicine to start taking responsibility for the way it is offered? And Ellen was like, I use this term with her family, she was a true bodhisattva. She really embodied it. And that's what I've been talking about all hour, is not talk about meditation, embody wakefulness. Embody wakefulness and heartfulness, because the words mind and the words heart in all Asian languages are the same word. If you don't understand mindfulness or hear mindfulness as heartfulness, you're not understanding it. And sometimes we just talk about mindfulness. It's just bullshit. Talk about compassion. Equal bullshit. How about we live it and let others do the talking? So thank you very much, and just such an honor to be able to give this talk.